Good afternoon. My name is Ines Maturana. My husband Ernesto Sendoya, a formerly successful software engineer, was diagnosed with amyotrophic lateral sclerosis, ALS, or Lou Gehrig disease, in 2002 and has been declining ever since. In fact, in 2002, he lost his voice. In 2003, he got a feeding tube. In 2004, he lost the movement of his arms. In 2005, he was vented. And in 2007, he lost the movement of his legs. Currently, Ernesto's care is performed by a full-time personal attendant, PCA, various occasional workers, a nurse and nurse's aide provided by our private insurance, and me. In order to maintain Ernesto's safety, a portion of his daily routine needs to be done by 2 people. We need 2 people to transfer him from the bed to his shower chair and or wheelchair, to boost him and give him a shower. It is impossible for one person to do it alone without jeopardizing Ernesto's health. Since 2004, he has been receiving nursing and nursing aid services through our private insurance, as I indicated previously. These services have been invaluable to ensure Ernesto's health and safety, to the point that within the last year, we did not have to hospitalize him, not even once. Because he's on a ventilator and completely paralyzed, he cannot be on his own, because if anything goes wrong with the equipment, he cannot troubleshoot, which could easily result in his death. In August, I received a notification from our private insurance that they will drop coverage for the nurse that visits my husband and the nurse's aide that comes for 4 hours during the weekdays and 2 hours on weekends. For us, it is unacceptable that a service that was provided when he was more mobile and is suddenly discontinued when he's completely paralyzed, most vulnerable, and depending on others for his every need. After an appeal process, the insurance decided to continue services through December 31st to allow us enough time to look for other alternatives. To get a sense of Ernesto's condition and the critical need of these services, I will read excerpts of the letter of support that his doctor wrote when we appealed our private insurer. She said, his home services serve a crucial medical need in terms of maintaining his pulmonary function and skin health. His medical goals are clear: to prevent skin breakdown, prevent pulmonary compromise, and maintain his safety. Further in the letter, she adds, he's at high risk for airway compromise, pulmonary infection, or skin breakdown if he does not continue to receive his home services. Any of these problems could lead to hospitalization, progression of his ALS, and/or death. Over the past 7 years, we have exhausted our savings to pay for out-of-pocket expenses and cannot afford to pay for additional healthcare workers. Furthermore, not having the services of a nurse unnecessarily delays the networking and coordination to get the procedures that he needs to stay healthy. This results in unnecessary frustration for me as his primary caregiver and costly trips to the emergency room. Representatives from our private insurance have strongly encouraged us to obtain Medicaid. However, meeting the $65,000 spent down within a period of 6 months is almost impossible, and we're not eligible yet. We are in the process of submitting our expenses to qualify. Nevertheless, dealing with Mass Health has been very frustrating because every staff member provides different and contradictory answers, and our request for a hearing to have somebody explain our status was denied. My husband is 58 years old. In 2 years, at age 60, he could qualify for a spousal waiver and will become eligible for Medicaid home and community-based services. My goal is to keep my family intact while we go through this ordeal, but as of today, I have no answers as to how I can do that. Now, when my husband is in an advanced stage of the disease and we need the help and the support more than ever, it is unfair for the health insurance to drop these critical services and for us not to have any other viable alternatives. We're not asking for a handout because we're paying health insurance and have paid between the 2 of us for 32 years. He deserves to have the coverage for what he needs to keep himself safe and healthy. I hope our case will help you in implementing policies that would cover people such as ourselves who work to make a living but cannot afford the rising costs of a chronic illness or fatal diagnosis. Thank you very much.